The story of Ignaz Semmelweis, the pioneer of medical hygiene. Welcome, folks. Before we dive into the amazing story of Ignaz Semmelweis, the pioneer of medical hygiene, please hit that subscribe button. Get ready to be inspired. Once upon a time, in the picturesque town of Buda, Hungary, a baby boy named Ignaz Semmelweis was born on July 1, 1818. Little did anyone know that this child would grow up to be a medical pioneer whose work would forever change the way we practice medicine. Ignaz's early years were marked by curiosity and a thirst for knowledge. He showed an early aptitude for science and a keen interest in the world around him. As he grew, his parents recognized his potential and encouraged his education. Ignaz attended the prestigious University of Vienna, where he embarked on his journey to becoming a physician. In the mid-19th century, Ignaz Semmelweis found himself working at the Vienna General Hospital, one of Europe's leading medical institutions. It was during his time there that he made a discovery that would shape the foundations of medical practice. He noticed a stark difference in maternal mortality rates between two maternity clinics within the hospital. One clinic was run by medical students and physicians, while the other was managed by midwives. The contrast in outcomes was astonishing. The clinic staffed by medical personnel had a shockingly high maternal mortality rate due to a devastating illness known as Puerperal Fever, which often struck women after childbirth. Driven by a relentless desire to uncover the cause of this tragedy, Ignaz Semmelweis began to investigate. He hypothesized that puerperal fever was being transmitted from the hands of doctors who had recently performed autopsies or examined cadavers to the vulnerable women in childbirth. His groundbreaking insight led him to a revolutionary idea. Hand hygiene could be the key to preventing the spread of infectious diseases. To put his theory to the test, Semmelweis introduced strict hand-washing practices with chlorine for the medical staff before they attended to patients. The results were nothing short of astonishing. The maternal mortality rate in the clinic plummeted, bringing relief to countless women and their families. Ignaz Semmelweis had discovered the power of simple hand hygiene in saving lives. However, his groundbreaking work was met with resistance and skepticism from the medical establishment of his time. His ideas challenged deeply ingrained beliefs and practices, and many were unwilling to accept this radical change. Ignaz Semmelweis faced frustration and isolation as he tirelessly championed the cause of hygiene. Tragically, the stress and rejection took a toll on Semmelweis' mental health. He battled depression and mental illness, which ultimately led to his confinement in a mental institution. It was there, in that quiet solitude, that Ignaz Semmelweis passed away on August 13, 1865, at the age of 47. But the story of Ignaz Semmelweis did not end with his passing. Over time, as the importance of his work became increasingly apparent, his ideas gained acceptance and recognition. Semmelweis' pioneering work laid the foundation for modern infection control and hygiene protocols in healthcare. Today, we remember Ignaz Semmelweis as the father of infection control. His dedication to the pursuit of knowledge, his determination to challenge convention, and his discovery of the life-saving power of hand hygiene have left an indelible mark on the practice of medicine. His story serves as a powerful reminder that sometimes, the most revolutionary ideas are met with resistance, but with perseverance and evidence-based practice, they can change the world for the better. The next time you wash your hands in a hospital or healthcare setting, remember the legacy of Ignaz Semmelweis and the profound impact his work has had on how we care for the sick and vulnerable in our society. Thanks for watching. Don't forget to hit that subscribe button.